get a thumbs up if you guys could listen, hear us.
We can hear you.
Oh, wonderful. Thank you.
Okay, great. So I'm Dr. Horn.
Dr. V.
Hi, and so we're going to talk about the Moderna vaccine and a little bit about Moderna versus Pfizer vaccines. And really it's to answer any questions that you have and go over kind of a brief overview and then make sure everyone's questions are answered.
I wanted to start off with like the phases of clinical trial because, you know, what do we do in each phase? So, you know, first phase, for both of the trials, you know, you have a smaller amount of patients. You see if the vaccine is safe. Are there any serious side effects? Second phase, most common short-term side effects, and you have a little bit more people enrolled. And third phase is when you have a lot more study participants. So in Moderna, I think they had about 30,000 and Pfizer close to 40,000 patients enrolled. And fourth phase, so that's the important thing to know, is once we get vaccinated, now we are all monitored to see if there's any adverse events, and then that'll continue for a long time to keep a track of any adverse events or side effects.
So the Pfizer and Moderna vaccines, when they looked at them, they were both about 95% effective. And so really, I mean, that shows that they're both very effective. And we can't really say that one is more effective than the other. But we can say that, you know, from the studies that we have, that they both work very well. So, you know, people are asking us, you know, should we get, they'll call and they'll say, would you recommend that I get the Pfizer vaccine or the Moderna vaccine?
Yeah, I've gotten the question a lot too. For me, I usually say they're both equal.
Right. So whichever one is available, whichever one you can get is how I've been answering that question.
So,
is that what you've been saying?
Yes. I'm
okay.
like, whichever one your hospital system has, get that. And some hospital systems have both. And I'm like, whichever, you know, they could give it to you, just take, because both of them are over 95% effective. And
when it comes to side effects,
yes,
is there one that you recommend over the other?
You know, we're going to talk about the Moderna side effects today, but they're both pretty much the same, you know, like fevers, muscle ache, fatigue, redness at injection site. So they both have pretty much similar side effect profile too. And again, when I say side effect, I call it like post-vaccine reaction. It's your immune system kicking into gear.
Right, and it's the same kind of thing I think of when you get the flu shot, because they have the same kind of reactions that they track. People get, like you said, you know, soreness at the site, some redness at the site, and some fatigue, fever. But really, you get those with any vaccine.
And I was reading an article that apparently shingles vaccine has more of this than the COVID vaccine sometimes when they're comparing. So as far as these reactions you get, not all patients, but some do, I think, you know, manage them with Tylenol, ibuprofen, rest, and then you should be okay.
Right, and really it's, so I think of the reactions after the vaccine is not comparable with getting COVID.
Yes.
Right, so you'd rather have some of these soreness at the site and the fatigue rather than getting COVID, and that's really what I think it should be compared to, right?
And like last time, I got the Moderna vaccine because I participated in the trial. So the first vaccine I had, they didn't unblind me yet, but I'm pretty sure I got the vaccine. First shot, I had redness, swelling, a little bit of fatigue. 28 days later is when you get your second shot. And when I got that, I actually had fevers, you know, over 100.3 fevers, fatigue. And I had to rest for a day, and then I was back to normal. So again, and I've been doing well, and I actually participated in August. So looking at me 4 months into this, I've been doing great, no major issues at all.
And on the slide, so it says both are mRNA vaccines with a 2-dose schedule. And so it's actually quite reassuring, I think, that both of them are mRNA vaccines, and both of them had about 95% effectiveness. And so, you know, this mRNA technology, you know, it's very reassuring to me that there are 2 studies looking at mRNA vaccines, and they were had pretty similar outcomes, I think.
Yes.
So I mean, to me that's pretty good, and that's what you want to see I mean, they're not exactly the same, which we'll look at what's in them, but when you look at a new technology or when a new study is done, you want to see that it's reproducible, and being able to reproduce the study like this
in a massive scale,
right,
40,000 and 30,000 getting similar
yeah.
data back, I think it's very positive.
Yeah, it's very reassuring, exactly. And let's see.
And this is really nice because we've been getting questions on who was enrolled in the studies. So Pfizer, 43,000, Moderna, 30,000, over 150 to 89 clinical sites. Many sites were US as well. But if you look at the also racial and ethnic distribution, they had good distribution among different race and ethnicity as well. So I think that's important to know, and also different distribution in the age as well. So by doing different race, ethnicity, age, they were still able to show it's over 95% effective. So that is very good for both of the studies.
And so this is what are mRNA vaccines. So mRNA carries the genetic material that it's essentially like a script or like the information to code the protein. So it's giving our cells the information to code the protein. Our cells create the protein, and then we create antibodies to it. So it's a new way of doing it. I think it's pretty genius thing to do.
We talked about it last time. We wanted to cover it again because, you know, we get a lot of questions about, is this going to change our DNA?
Oh, right. And the mRNA doesn't last very long. It appears, you create the protein, and then get the response from your immune system, and then it goes away. Yep.
So this picture nicely shows that too. So when the mRNA gets into the cell, you know, when we, in the deltoid, for example, cells, when we inject ourselves, ribosomes encode the protein, you know, cells immediately make antibodies to the, you know, the protein that they see, but it does not go into the nucleus. And then mRNA gets destroyed by RNase enzymes. And I like the analogy you were telling me earlier about, like, mRNA is like a little software.
Right. So the DNA is essentially like storage, right? And then the mRNA is like the software, and then the proteins are like the applications.
And then the software, just like Snapchat, it comes and it goes away, and it
the software. Oh, sorry. Yeah, so it's like the software. The mRNA is essentially codes it, and it's the software.
Yeah. So it doesn't stay in your cell and get into your DNA at all.
So it's not new technology. So mRNA, you know, this is the first time we've had a vaccine like this, but this has been studied for a long time and thought about for a long time. So, you know, it's it is new, but it's been, you know, discussed and thought about and tried for a while. This is really, I think, the first time it's been able to work, though.
Yeah, they've used this technology in like other viruses, like we see Zika, rabies, influenza, CMV. You know, unfortunately, like, we didn't get funding like billions of dollars until when we really needed it this time, and the push and the resources. And I think that's why we were able to accelerate. Another question we always ask is, how do we have so much vaccine already made? And that is because while they were testing, our government, federal government, was fantastic, really smart, and they paid to make those vaccine also at the same time. So once we figured out it works, they already had millions of doses made up.
Right, and like you said, the funding and they just, the big push, Now, and these are the side effects it may include, and this is what we discussed: fever, headaches, some muscle soreness.
This is kind of like the general side effects, but we'll get into the study. So this is a table from the clinical trial where they are talking about the side effects: placebo, the saline, and the first and second dose. And they documented headaches, myalgia, arthralgia, nausea, vomiting, and fevers. If you guys look at fever, they also graded at different grades, but just in general, fever is definitely higher in the Moderna vaccine just for this study with the second dose. And also, you know, a little bit of chills, and most of the side effects are a little bit more with the second dose than the first dose. So that's why it's really important to stagger their dosing. So let's say that, you know, you don't want to vaccinate in your ICU, you don't want to give all the ICU doctors a second dose on the same day. So it's important to, like, stagger it every 48 hours or 24 hours, so everybody gets a little bit of respite between that time to recover, for the immune system to get working and then feel better.
Right. Yeah. So if everyone gets it on the same day, like everyone in the emergency room, emergency department, if they all get it on the same day and then the next day they all have a fever or they feel fatigue, that's, yeah, that's exactly, that's why they're getting, it may be a couple people from the ED get it one day and then a couple of people.
And especially that's important
day.
to do it with the second dose and the first dose.
Yeah.
So to make sure. And that's exactly how I felt. First dose, I got it in the morning and I worked through the day, no major issues. But then the second dose, I needed a day off.
And here, and you can see, like, really, like all studies that they do, they'll have people that, got the placebo will have fevers and headaches and chills and some of the same things.
But at a very low.
Oh, right. But they're very low. Right.
Yeah.
So it's, yeah. And so this, just like getting the flu vaccine, people get the same kind of reactions. Just.
So I think in your hospitals, when you guys get the Moderna vaccine and start vaccinating your employees, I think you're okay with the first vaccine. The second vaccine, I think staggering, having a plan would be a good idea. And exciting news, there are a bunch of other vaccines in the works: AstraZeneca, Johnson & Johnson, Novavax. Yesterday, I think it was today, they just approved AstraZeneca vaccine in UK. So that technology is a little bit different. The two vaccine we have is mRNA vaccine. AstraZeneca vaccine, it's actually made from inactivated adenovirus, like the other vaccines we have made in the past. So it's a little different. Efficacy is about like 70%. However, the storage issues and things are very not that concerning. So then it's easier to mass produce and supply to a lot of areas where they might not have the facilities to store and keep the Moderna or Pfizer vaccine.
Right, and that's part of the issue with distribution of Pfizer versus Moderna, and how easy it is to store them, really. Oh, and here are the ingredients. Okay, so we have Pfizer versus Moderna. So we have both of them have the mRNA. Both of them have some lipids and some salts and sugars, and so you can see this is what they have in there. The Pfizer, sometimes people, some of the anti-vax people will try to use anything they can to try and scare people, and really, I like when they show what's in it, and you can essentially see that it just has some lipids and sugars and salts and the mRNA. And so like we talked about before, you have the mRNA, and then you have kind of this fat bubble. You have kind of a micelle, just kind of to get it into the cell, and some salts and sugars to, keep it stable, get it in very well. And so, really shouldn't be worried about things like that people try and use things like saying, oh, they're preservatives or something. And all of that is used kind of, like I said, they use anything they can to try and scare people, whether it's has any merit or not. And really most of it is just kind of anything people can grab onto to try and scare people. So it's not a concern that I would have.
Yeah, and I think it's always important to, when our healthcare workers ask questions or our healthcare staff members ask questions, to be able to tell them exactly what's in the vaccine. And I really like this slide. It's borrowed from CDC. To say both vaccines, they have mRNA, the message, and lipids and salts and sugar. And just to be clear about that, and there's no preservatives, like you were saying, the more clear that we could be to our healthcare workers, I think the more it'll be trusted. Does AstraZeneca vaccine come in multi-dose vials or single-dose packing? Unfortunately, I'm not sure yet. So more to come on that information. I will find out if I get some more information, but I'm assuming in the next couple of weeks, we'll have more AstraZeneca vaccine info coming up. And also something important to let people know, Moderna vaccine, because this we always get asked, there's no preservatives, there's no egg products, and there's no latex products either.
Okay, and this is information about how well the Moderna vaccine works. And so, and this is what we were referencing before, that it's 94% effective, and that's very good, right? So 94% effective, it's essentially the same as the Pfizer vaccine when it comes to efficacy. And it's high effectiveness in the clinical trials. And it really didn't matter their age, sex, race, ethnicity. It worked very well. And a few people in the clinical trials were admitted to the hospital, and there have been some reactions, as you know, as many vaccines do. But all of those people are doing well.
Yeah.
So some of the people had reactions, and some of the people that had reactions actually have had reactions to other vaccines, such as rabies. And really, those people were, you know, had a reaction, but then recovered, and they're doing well.
And then here is a really nice slide from the actual study. So again, the Moderna trial, patients would be followed for 759 days, which is about 24 months, 2 years. So it's a long-term following of the participant. And it's important to know that we don't know yet the antibody response that we get from the vaccine. Does it last 1 year? Does it last year and a half? Does it last 5 years? So we don't know that answer yet, how long. And so that we have to keep following all the participants to get that answer.
Right, and that's a question with, you know, when you get COVID, how long do your antibodies last from getting COVID versus from getting the vaccine? How long do your antibodies last? How well are you protected? And, you know, this is a question that's going to take a while to answer.
Yeah.
I think that not only are you protected from getting COVID a second time, but when you get, or if you get COVID a second time, how bad will your reaction be? It may be that you get it, but you're not as sick as you were the first time. But these are right. These are just kind of some unknowns right now.
And again, I think it's really important to remember, just because you get vaccinated, you still have to wear a mask and social distance, because you don't know, once you're vaccinated, can you be asymptomatic carrier and infect others? So until we have, you know, data is coming out, 70 to 80% of US population vaccinated, we have to wear a mask for a long time until we get to that point.
Right, and when we say 95% effectiveness, in the trials they were looking to see, they were following people that when they developed symptoms and they were tested for, and they had COVID. So this, you know, you may still be able to get an asymptomatic infection, but I think we'll see here actually that when it comes to severe infections, that it did appear to prevent severe infections. So in the Moderna trial, you see here that you have the vaccine group and you have the placebo group looking at severe infections. And there were no severe infections in the vaccine group, but there were 11 severe COVID patients in the placebo group. So it appears that it prevented severe COVID. So,
and that's what we worry about, ending up in the ICU.
And that's the goal, right?
Yeah, exactly.
So if somebody gets COVID, but it's not very bad compared to getting severe COVID, and prevention of severe COVID is really, you know, what this is all about, right? Yeah.
And this is another way, you know, sometimes pictures are great to see exactly what we just said. The red line is the patients who got the vaccine, didn't get infection. The blue line is the placebo group. And as you could see, they got the infection. So it's, again, another way of showing that reduced risk when you get the vaccination to get clinical symptoms.
Oh, good. And so we have another question. So it says, for patients who have a reaction, do you still proceed with a second vaccine?
Yeah.
And so, and really the question would be, how bad was the reaction?
Yeah, we're going to get to that right now.
Oh, good.
So this information is right from CDC website. I know there's going to be a COCA call from CDC today about allergy and reactions as well. If they release the slides, we'll send them out to you guys well. But what CDC is currently recommending is if you have had severe allergic reaction to any of the COVID-19 vaccine, then don't get the vaccine. So let's say you had a severe allergic reaction to the first vaccine, you probably shouldn't get the second vaccine. But not when you consider severe allergic reaction, it shouldn't be like you got redness on the injection shot, you got some fevers. That's expected.
Right.
Severe is when, you know, you get shortness of breath, lip swelling, you know, anaphylaxis type reaction. If you have that with the first shot, then you shouldn't get the second shot. And, you know, maybe even getting them to see an allergy immunologist doctor might be helpful. And then they probably hold off until we get the other type of vaccines, right? Like AstraZeneca. But, yeah, go ahead.
Oh, so if you've had a severe, if you think you had a severe reaction, then I would ask your doctor. I'd ask them, you know, what they think and get their advice.
Yeah.
And that goes with, you know, if you've had allergies to other things that have severe reactions, then essentially discuss it with your doctor and see what they think.
CDC currently recommends if you have allergies to food, pet, venom, environmental latex, you could still get vaccinated. They also say if you have allergies to oral medications, other allergies, you could still get vaccinated because those are not part of the COVID-19 vaccine. But if you, so I just want to emphasize, if you have severe allergic reaction, anaphylaxis with the first shot, you should probably hold off on, you shouldn't get the second shot, see an allergy immunologist or a physician to kind of get evaluated for that part.
Right, and even just getting one shot does give you some protection. So if you got one shot, you know, if you did have a big allergy to it or reaction to it and can't get the second, that would still give you some protection, even though you didn't get the second and complete the series.
Safeguards. So every vaccination site should monitor patients without history of allergies for 30 minutes and other people for 15 minutes. And I'm sure you guys have all seen that in US, we have had 6 cases, right, of anaphylaxis. And a lot of the cases have had severe history of allergies in the past. So again, it's really important to make sure we have these things in places at vaccination sites. And to make sure if somebody does develop these severe allergy reaction, you get immediately emergency care, you know, and also you need to have monitor them for several hours to make sure they do okay.
Right, and all 6 of those people, I think they were being monitored and they did get good care and they were doing fine.
Yeah.
Oh, and so this is what they say to have on site where people are getting vaccinated, and really these things, you know, I think this is pretty standard. I think having things and being in a, you know, in a place where you can provide care if needed should be available at all sites. It has, let's see, an EpiPen, antihistamine, blood pressure cuff, stethoscope, and a timing device so you can look at their pulse. And when feasible, it has some additional things. But really, I think, like we said, so having a severe allergy, they're giving out millions of doses, and there have only been 6 in the United States so far. So having a reaction is quite rare, but it's important to, you know, be on top of it so you can give them care if needed. Yeah.
We have a question about, can you have allergies several days? Was told a nurse in Tennessee got the shot and days after the left-sided drooping. Yeah. So Bell's palsy has been one of the questions that's been asked. So the data in the vaccine group, when they did both the Pfizer and Moderna vaccine, they did have some Bell's palsy, nerve droop. But when they looked at that with the general populations of incidence of getting Bell's palsy, it was much higher rate in the general population than the vaccine group. So we were not really able to just say, was it a vaccine or would it have happened automatically? But when you do get this type of reaction, of course, you know, the CDC, you have to have the vaccine safe app and you have to report and keep in mind. But it's hard to answer this question right now because they did have some Bell's palsy in both of the Pfizer and Moderna group. But in the general population, the rate is much higher than that. So is it incidental or is it vaccine related? We're not sure. What do we say about pregnant person who cites the lack of outcomes data? Yep, very good. So we don't have any actual data on pregnant patients yet. but American College of Obstetrics and Gynecology, ACOG, and American College of High-Risk Pregnancy, they have both recommended that pregnant females should get the vaccine, especially if you're frontline pregnant females. Their concern is pregnant females will get COVID, end up in the ICU, they do bad. So having the vaccine is much safer than ending up in the ICU having the COVID infection. So I think every pregnant female has to kind of weigh the benefits and the risk with their OBGYN primary care doctor and decide this. But I've had a lot.
Watching the webinar.
I have had a lot of healthcare workers who are pregnant who have gotten the vaccine. So more to come on that.
Right, and so right, so a lot of pregnant women have gotten the vaccine, and actually I think the CDC is looking at that as well, because if people are vaccinated and then they realize that they're pregnant, they can notify, and also I want to say it's around 500 people now in the U.S. that are pregnant that have gotten it, that have notified that they were pregnant at the time. So, you know, I think we're going to have a lot of.
We cannot hear you.
Can you hear us now?
Oh, good.
Okay, thank you.
Okay,
Sorry.
so we were just saying that it's important to talk to your doctor if you've had Bell's palsy in the past, or Bell's palsy in relation to getting a vaccine. So that would be one where talking to your doctor and kind of looking at it case by case.
In my mind, though, if it was me, and I'm a frontline worker and I have history of Bell's palsy, which I didn't know for some other reason, but you know, working and getting COVID, I probably still get the vaccine after having a good conversation with my doc and making sure it'll be okay. ACOG seems to be the outlier compared to recommendation from Europe and Canada. I think every country is kind of looking at this, but again, if you think about it, it's an mRNA vaccine. It's helping you produce antibodies. It doesn't enter your nucleus. So for me, the biggest concern I would probably have with a pregnant female getting a vaccine is like the reaction that they get and having some downtime to get better.
So it says, what is the time period between getting the second dose for Moderna?
Yeah, so that hasn't come out yet. I need to look at it, but Pfizer, yes, you have about 4-day grace period. So if it's 21 days, you could get up to 25 days. I'm thinking it's the same thing with the Moderna vaccine too. Let me look that up and I'll email you guys when we send the slides about that. I'll write that down. But I believe it's about 4 days as well for Moderna vaccine, the grace period too.
Let's see, I was trying to see if there was make sure that we got all the questions. I'm not sure if, let's see. Let's see, I was trying to make sure that we answered all of the questions. Okay.
Okay. The other question is the same Moderna for CDC clinical consideration?
It is the same for Moderna.
Oh,
okay.
Perfect. Thank you for helping us with the answer. So it sounds like it's the same. And there's been questions about should you, if you get vaccinated, and then we have had some cases where people have gotten the first shot and then actually have developed COVID-19 infection in between after the first shot. So what we're saying that we're getting asked, should you not get the second shot? What our recommendation is, if you get first COVID vaccine, if for some reason, if you develop COVID-19 infection because you got exposed to somebody, then get better from that infection 10 days. And once you're asymptomatic and you're better from your COVID-19 infection, get the second vaccine. If it needs to be bumped up a little bit longer, you can do that. There's before and after, so 4 days before and after, such as Pfizer, 17 to 25 days, 24 to 32 days for Moderna. Thank you for sharing that, Jordy. And there's a link as well.
Let's see.
And then we had a few more slides about building confidence of the vaccine and the healthcare, because if we need to be confident enough to get the vaccine and know how to speak about the vaccine in order for our patients to get it eventually when it's available.
So these are some strategies to build trust and empower and engage the communities. And this is very important. You know, I think with vaccine rollouts, it's very important to, you know, have a big push. And really, you know, it would have been nice to see a big push supporting vaccines, you know, right at the start of this, right?
Yeah.
Right at the start of when COVID started happening and the vaccines went into, you know, overdrive trying to get them all completed. But it's very important to promote confidence in the vaccine and engage communities. And personally, I think the best way to do that is to show the data, is to show, you know, the studies that have been done and discuss, you know, what the studies are showing. You know, and all of it should be to promote confidence in the vaccine with the information that we have. So, you know, vaccines aren't perfect, and some of these, you know, some of the problems that are, problems that we're having as far as getting vaccinated, and there are very few reactions and issues with it. But that's almost expected. I mean, if you push out a vaccine to millions and millions of people, there are a few people that are going to have reactions to it, especially the patients that have had reactions to vaccines in the past. So vaccines aren't perfect, but it really, to me, the thing that makes me feel better about it are looking at the actual studies and seeing, you know, how well it works is that how you feel too? Or?
Yeah, I think it's really important for us to know the information and be able to clearly communicate with the patients in the community. I'm sure you guys have heard a lot of data about, you know, in the community, there's a lot of people are scared about the vaccine. There's also, you know, they've done some surveys and such where patients in the community who are in the minority community, there's some concern about the vaccine. So I think building trust is going to be really important. And one way to do that is to, you know, having healthcare leaders as champions, taking pictures, posting videos, and also, you know, having healthcare leaders who are from different race and ethnicity promote the vaccine and show that they took it. So I've been speaking as a woman of color to people that I meet, how I took the vaccine. I've been safe, I've been doing well. And I think it's going to be important to continue to spread that message, because, you know, it's going to be in a couple of months, it's going to get to the point where we're going to have to start vaccinating our community. And we have to send a really good message now, so then we have higher vaccine acceptance in few months. Is that kind of what you think as well?
Oh yeah, no, I think I support everything that you're saying. I think that's exactly the goal. And here are the top 6 strategies for building COVID-19 vaccine confidence in healthcare personnel. Encourage senior leaders to be vaccine champions. And so just like you're saying, sharing pictures of getting the vaccine, when you see people getting the vaccine, it really does inspire confidence. You know, I think seeing infectious disease doctors and really anyone that's in healthcare get it, especially for their community and their family, when they see that, you know, you have trust in the vaccine, that you're getting it and that you support them getting it, I think it really does a lot to, you know, inspire confidence in people that aren't as healthcare literate. And you know, I think it was Obama that said, you know, if Dr. Fauci gets it, I'll get it. And I think that's really the way to look at it. If you know, Dr. Fauci gets it, you know, I'll get it.
Yeah.
Right?
And I think it's important. healthcare leaders, but not just physician champions. You know, I think
Right.
champions from different departments in your hospital, you know, EVS leader, pharmacy leader, you know, your PTOT leader, and having different nursing leaders are extremely important. Getting the vaccine, so then they, you know, I think sometimes when they see doctors, oh, here's another doctor talking about it. But I really think when we have more healthcare leaders from different departments getting the vaccine, it really builds that confidence.
Right. And, you know, I've seen nurses talk about it and they say, you know, especially really anyone on the front lines, they say, you know, I've seen how bad getting COVID infection is. So anything, there's no way the vaccine's going to be as bad as getting the, actually getting COVID.
And, you know, different hospital system have different strategies. So again, it's, you know, posters, online posting, videos. And here's really, we have given the CDC link too. They have like little stickers you could print and put, different posters, so that, making videos to be able to help promote this is going to be really important and key. Any other question? Do you think COVID vaccine will end up being the flu vaccine annual shot? Or how long? We're not sure. Again, I think this is going to be more information coming out as they follow the 70,000 participants in the mRNA vaccine with Moderna and Pfizer to figure out how long they have the antibodies in their bloodstream.
Right.
So more to come. I'm not sure. So far, what we know is that we have about 4 months worth of data when they started the clinical trial to December. So that, you know, it's effective for 4 months, but we're going to need more data.
Right. And my guess is, that would be my guess, right? I would guess, you know, it might go into, you know, every 4 years or 5 years or something like that. I think right now the most important thing is, you know, getting this pandemic under control.
Yeah,
get
the vaccine. Maybe it might be every yearly vaccine, but I'll do it.
I'll do it. Right. Yeah. Let's see.
Assuming same rules apply to Moderna vaccine as in regards to passive immunity. Yes, you're right. So if you get immunoglobulins, so let's say you got somebody's plasma for COVID-19 infection, or you get those monoclonal antibodies, you know, now we have BAM and other ones, you have to wait 90 days before you could get the vaccine. We have had a case where the patient got first dose of vaccine, got an infection, they got BAM. So myself and Dr. Hoon talked about it. We're like, the second dose should probably be delayed for 90 days. There's some information CDC says, if you know, get the second dose when you can. So that's what we can say for now. But yes, if you have gotten passive immunity, immunoglobulins, or the BAM monoclonal antibody, you need to wait 90 days.
Right, and waiting 90 days, you know, and my guess would be in the next 90 days, we will have some more guidance.
Yes.
But
now.
But I completely agree with that. I think that's the way to do it. There's a question about, you know, if someone's had COVID, if they get the vaccine, let's see, would they have more of a reaction to the vaccine if they've had COVID?
I don't think if they get more or less, I just think you get the reaction as expected for the vaccine. I don't think having COVID before is going to trigger you to have a more severe reaction with the vaccine. Yeah. But that's what I'm thinking. I don't know if there's any data on that, because we'll probably get data coming out.
I could see that happening. I think, you know, and my guess might be that their first shot, they might have a reaction like the second shot if the person hasn't had it. That would be my guess. But it's still recommended to get it. But yeah, no, that's a very good question. Let's see. And are previous COVID positive people seeing more side effects with the first dose, and will they likely have side effects with their second dose? I think that's something that we'll see, and that's
we don't have any data on that yet, but I'm assuming they might have more fevers, redness than the expected on the first shot. Why is natural immunity disregarded for the previous? What we're finding out is, I've already seen in our clinical practice, patients who have gotten an infection with COVID like 4 months ago, they're getting COVID again. So what we are assuming is that natural infection doesn't give you long enough immunity, but vaccine is able to produce longer immunity. So that's one of the reasons we're saying everybody to get the vaccine, even if you've had infection in the past.
Right, and those people, we are seeing people, when we first started seeing them, the question was, is it the test or are they actually getting COVID a second time? And it does seem like they're getting COVID a second time.
Yes,
We've seen people that have had a positive test in the past and they're coming back in with COVID again,
and
with
it's
CT findings and everything.
It's like 5 months later, 6
Yep.
months later. So we're definitely seeing reinfection. But the theory is if you get vaccinated, just to clarify, they're recommending no 90 days wait period to get vaccine if you have, yes, they're not recommending you wait 90 days if you have had COVID. There was a recommendation if you have had COVID, you can wait 90 days so that you could give that vaccine to another healthcare worker because you might be protected for 90 days. So you could get it after 90 days. But there's no recommendation saying don't give it if you within that 90 days. So let's say if I get COVID-19, in next 10 days I get better, I'm a frontline worker, I could get my vaccine at day 14. If I'm doing no symptoms and if I'm doing well, I could get my vaccine at day 14.
Let's see, assuming the same rules apply for Moderna vaccines as for BioNTech in regards to passive immunity.
We talked about,
Yeah. Let's see. So I think those are all the questions. If we missed a question, please let us know.
Hope that was able to answer your questions. And what's nice about a lot of the hospitals now getting Moderna is you don't have to worry about the ultra freezer to be able to store. So please email us. Let us know if you have any questions. We'll send the slides out with some of the links as well. Thank you all.
Great. Thank you so much for joining.
Yeah, thank you.